So I've made it all the way over to hall number 7 now, and I'm joined by Henry Vincenti from Endoca. Henry, great to see you. Now, you are selling cannabis.
That's correct. We are working with cannabinoids made out of cannabis.
Now, this isn't as controversial as it sounds, is it?
No, actually not, because it has been used for thousands of years, and we're just reinventing the wheel.
And and so, have you been very popular so far?
Well, in some circles, I will say, but in other circles, not that much.
Now, let's just start by clearing up the fact that you don't get high on your products. You've actually removed the active ingredient of THC, haven't you?
Yeah, so what we do is we're specialized in growing cannabis with high amounts of CBD, cannabidiol. And in our plant material, there is no THC, so you don't get high, but you get the other medicinal effects.
Okay, so give me the pitch then for cannabis. Why is it a good all-round medicine in your view?
Well, look, it's the future medicine, because what we see is that cannabinoids, not only in experience, anecdotal experience, but in preclinical studies and clinical studies, they are working in a magical way. What they do is they attach to the CB1 and CB2 receptors, and they stabilize your endocannabinoid system, which makes you sleep, eat, forget, relax, which is the most important component if you want to get cured.
It sounds marvelous to me, yes. Eat, sleep, what was it? Eat, sleep.
Relax and forget.
I was playing with you. Okay, so now so given that you are a convert to this, what can you use it for? What disease modalities or for what kind of health?
Well, what's happened is that you have about 3% in the world using cannabis. And you have a lot of anecdotal testimonies. So some people say it's working for arthritis. Some say, look, it cured my cancer. Others say, look, it works for epilepsy. And now what we see is some companies are starting to invest in clinical trials. So for example, some did investment in epilepsy, and now they showed with thousands of patients that it's actually working. And they're taking this drug to the market. But I will say this is just surface, because what we see is the cannabinoids, they stimulate your endocannabinoid system. You are producing cannabinoids already. It's called endocannabinoids. We are making phytocannabinoids made from plants. So what happens is we stimulate your body's already existing immune system, which is so complex we don't understand yet, but we just see that the effects are everywhere. And again, cannabis doesn't cure, I don't think, but it stimulates your homeostasis, so you go into balance and you start sleeping, you start eating, you start relaxing, and you start healing. Like a wound on your skin. If you cut yourself, you heal yourself. It's not a drug that heals you, it's yourself.
So tell me, now in terms of products, you've applied it to pretty much, well, a huge array, haven't you? So talk me through some of these.
Well, we created for European market the whipped body butter, which is just organic hemp extract with organic coconut.
Right.
It smells fantastic.
Does
you
it?
can,
May I smell?
yeah, you will want to eat it. It's so pure you can eat it. So, well, that's the intention. We make cosmetics that you can eat.
Okay, now there's a reason for that, though.
Of course.
Yeah,
of
so
course.
what is the reason? So
Well,
it's regulation, I assume.
of course, because it's too complicated with the paperwork if you want to sell it as a food. So if you sell it as a cosmetic, it's actually legal, and it's easy to put all the papers together and put it in all shops.
And this is formulated what, for daily use when you shower, when you bath?
Yes, this is a body butter, just like any other body butter. It's just different. This is organic, 100% eatable. So there's no toxins or anything that's bad for you. It's only cannabis and some coconut and some nice other herbs.
Do you use it?
Of course.
I had to ask, I didn't know. Okay, so what else?
Well, then we have the salve. It's more like a balm. You can call it also a balm. It's more strong in potency. So this is not so strong because it's just a body butter. This is a salve or a balm, which makes it much more stronger.
So this is for your lips, is it?
This is for lips, for if you have psoriasis, you put it here.
Right.
If it's a mild form, because it's not that strong, it's it says here it's 750 milligrams of CBD, cannabidiol. So it's a good support if you have some mild problems.
And what else? I assume you'll say it's good for eczema as well.
Sorry?
Is it good for eczema, for example? You said psoriasis. What about eczema?
Well, it helps for any skin condition because it's stimulating your endocannabinoid system in that region, and that's what we see on people that they have instant effects.
And what about using it for children?
Well, that's the whole trick. It's eatable, it's 100% organic, no side effects, so this is the only thing I use for my kids.
Right.
I think that's the only thing to do.
All right. What else do you have?
Well, here we have, I mean, what's the difference here is it goes up in strength, down in the size of the volume, because this is a repair. This is very strong. This is 2,000 milligrams of cannabidiol in a very small container. So if you have extreme acne or you have severe psoriasis, this is what you want to apply.
Okay.
Or if you have, for example, internal problems like epilepsy, or you have pain or sleeping problems, this is what you eat. It's a win-win.
And what did neurologists say to you when you say that if you eat this, you can get rid of your epilepsy?
Well, they already know that because the clinical trials have proven that it's working.
Right.
Since actually 1980s, where it was the first time they found out about it, it was in Brazil. They made a test with 15 patients only. They saw it was working. And only recently, it has been taken by a pharmaceutical company to another level, and they say it's working fantastically.
And is it in clinical trials at all in terms of being a pharmaceutical medicine?
Yes, it's already approved, and I think by the end of this year, you'll be able to buy pharmaceutical grade from another company that's selling pure cannabidiol for epilepsy.
Okay, well, I'll wait and see to see when that hits market. Let's see. And anything else that you have to show us?
Well, and then this is the drops. So if people have a problem using the cream, they can use the drops. It's just, again, very potent for repair situations where you have extreme conditions. And then we have, of course, the APIs. We have all this. We supply people who want to compound stuff or they want to do clinical trials. You have 99% CBD, 99% CBG, and CBN. So this is pure.
Okay, let me just ask you then, in terms of the industry itself, how important is CPhI worldwide for you to exhibit? You know, you've got the cream of the pharmaceutical industry here. They've got to be quite an important marker, haven't they? Your peers are very important in all of this.
Well, I think places like this is where the domains start to shift. So it's very important for new products like this and new ideas to be here, to interact with already existing ideas, because this is also here where you can find distributors, and it's here, the whole network of what it's all about.
Yeah. So it's early days here, but how have you got on so far?
Well, so far it has been challenging because everybody has been asking for the paperwork, which didn't exist because the regulatories are too late and too lazy. So that's why we developed now the cosmetic line, which is, well, it gives it the possibility now to put it to the market legally with all the paperwork, which I think people need here.
Right.
It's the
And,
paperwork.
and what's been the reception here at CPhI?
Well, people are very happy. I mean, we get a lot of different clients, but mostly I see there is a big enthusiasm, and more and more people are starting to see that this is the future of medicine. And we see also a lot of companies who want to take these and formulate their own recipes, and they're moving in that direction. So it's happening much more this year than it was last year.
I mean, I have to say, as a medical doctor, I hadn't really seen any medicinal or at least cosmetic uses of these kind of compounds until really recently, and other companies that came across my path. Are you seeing a lot of competition now in this space?
Well, not really, because there's so many people on this planet, and there is a lack of products. You can't buy it. So I think what has to happen now is, there is competition, but it's not really, because it just helps the whole cause of making people understand that plant extracts are very powerful. And it doesn't matter what brand is out there, it helps the whole industry.
Well, of course, aspirin, Salix alba, of course, many of our drugs, pharmaceutical drugs, come from plants.
People forget that. They think opiate is a synthetic thing. They forgot it came from nature. Aspirin, insulin. People don't know these things, but that's why we try to re-educate everybody and say, guys, remember the nature.
So tell me, at the end of CPhI, when you go home, what will success look like to you? What will make you happy?
Well, success, I think, is if we find people like-minded who are willing to take the chance and distribute it, or even though if we shift the paradigm just a little bit towards the natural side, and people say, you know what, maybe nature works. Let's explore. Then we did our part.
Well, I wish you the very best of luck with it. Henry, thank you very much indeed.
Thank you, sir.